Possible? Where's the switch? Okay. Let's see this.
Now, religious traditions are diverse and sometimes as bizarre as they can get. A village in Solapur in Maharashtra has a dangerous tradition of throwing newborn infants from a height of 50 feet onto a sheet held by devotees below. Here's a report.
These visuals may shock you. Infants thrown off the roof of Baba Sheikh Umar Sahib Dargah in Musti village in Solapur onto a sheet below held by devotees. This bizarre practice is an age-old tradition practiced by couples who are blessed with a child after taking a vow at the Dargah. The devotees also believe that this ritual is good for the health of the child.
You understood everything he said, okay?
While the practice may seem dangerous superstition to others, the devotees strongly believe this will not harm the infants. The reason, there has been no recorded evidence of any physical disability to the infants. While this practice may not have resulted in any casualties as of now, rationalists say that such dangerous rituals should be banned by the government.
These rituals are to be stopped forthwith, and the state has to interfere because these kind of rituals being practiced are a challenge to our sensibilities, and it's against the basic concept of our common well-being.
Every year, thousands of Muslim and Hindu families take part in this ritual. Some of them coming from as far as Andhra Pradesh and Karnataka. The state administration.
That's what I wanted you to see for a moment. Had you seen that on TV when it happened? Huh? No? Okay. Well, except this culture, in India, in Russia, when a child was to be baptized, it was placed in a bucket filled with iced water and left there until suffocation. And then they would take him out, or her. In Cyprus, in some villages, as soon as a child was born, he or she was dipped into wine and then wrapped in salt. Only after that was done would the midwife proceed with cutting the umbilical cord. For the next 7 days, the mother of the child was never left alone to protect against possible attack by evil spirits. In modern Greece, children, am I standing in front? In modern Greece, children are still dipped into the font to be baptized. In older times, the rite required the child to be dipped deep into the water 3 times, while the relatives and the priests were reciting prayers denouncing the devil. And in ancient Greece, they did something else. They had a fire, and they would take a child over the fire like this, almost charcoaling the baby, okay? I mean, why should some people do that to their children? Why should they do that? Why should they do such nasty things to their children? The answer is one, and you do not know it. It's rapid entity attachment release. In other words, it is a form of spiritual vaccination. They were throwing the kids from the tower because the possessing spirits went out away from the kids. The threat from the fire, the threat through suffocation, the threat from all this kept the bad spirits, the possessing spirits, away from the children. But of course, if you ask all these people, why are you doing this? Nobody knows the answer. Unfortunately, my office is on the first floor. Next time when I move, I will take one from the 10th floor. So when a client comes in, I will say, oh, come on, let me show you the view. Throw him down. If he comes back again, then I'm sure a lot of the ailments are going to be gone away. So, what I'm saying is this. This book that is next door to the A.R.E. is a book that I came into, I wrote last year to explain a technique that I discovered. And by the way, Edgar Cayce also has mentioned something about that. It is rapid entity attachment release with mechanical means, and actually with electricity. But I will come to that in a while. So what I'm suggesting that is that in there are a lot of possible causative factors for many physical and psychological ailments. I suggest that a lot of such conditions are not due to physical, biological, or psychological irregularities, but rather they are byproducts of unsuspected origin. More specifically, attaching spirits and obsessing entities that coexist in the same body as the rightful owner of that particular body. That means that my body may not carry only myself as a passenger, but it may be a bus or a train. Okay? I'm suggesting that, and I'm going to make my point as we go along. Now, the father of American psychology, William James, made that statement back in the beginning of last century. He said, the refusal of modern enlightenment to treat possession as a hypothesis to be spoken of as even possible, in spite of the massive human tradition based on concrete experience in its favor, has always seemed to me curious example of the power of fashion in things scientific. Welcome. That the demon theory will have its innings again is, to my mind, absolutely certain. One has to be scientific, indeed, to be blind and ignorant enough to suspect no such possibility. Now, we are talking about a genius. William James is probably far superior in mind than any other psychologist I have read. So, well, let me tell you a story from my practice. A lady came in from Athens to Corfu, which is about 500 kilometers away, and she came to my place, to my office, for therapy. And as we were talking, she told me that I was taking her intake interview, and she told me that she had done acupuncture, electroacupuncture. I said, what for? She said that she had taken those incongestants, how do you call them, you know, for the nose? You put otrivine, or how do you call it, a substance, nasal spray. And she was addicted to this. She was doing it all the time. So she went to the acupuncturist for relieving her. So he started using the electrodes. He was using electroacupuncture. And when she did so, she said, oh, then I felt something was moving inside me and was really upset and was moving and moving and moving, and it got me upset, and I stopped the sessions. And I sat there and I said, oh my God, this is it. I had that aha feeling, eureka, you know, the inside. Why? Because I had read Wickland's book. Carl Wickland was an American doctor back in the 20s, 30s, 40s. And what he did, he was using the Wimhurst machine. It's a generator a generator of static electricity. So he was given this information by entities in the spirit world, how to build it. So he built a huge machine, a Wimshurst machine, and when he did that, he took a person, he had him on his seat, and he started sending electricity waves on him. And static electricity, you know, is when you try to open the door in the car and sometimes you get hit by it. It's something very powerful, but not dangerous at all because it doesn't have amperes. It's only volts. Okay? It can go up to 200,000 volts. So Wickland was actually exercising electricity to his patients, and then he was expelling entities which were going to his entranced wife. His wife was as a medium, and so he would make those entities jump from the body of the patient, go to his wife, and then he would talk with them. That was quite a complicated history. But here, this lady is telling me, wait a minute, I'm feeling uneasy with the electroacupuncture. So then I started making a research, and I found amazing things. Electricity is present both in our environment and in the human body, but has electricity ever been used for therapeutic purposes? That was the question that started my research. Had it been successful? Do we understand why this worked? Here is a brief historical regression. So here we are. This is the torpedo fish. It's all around the Mediterranean and in the Nile. Okay? So the oldest known stone carvings show use of electric fish. As shown in the picture, for painful conditions are found at the 5th dynasty burial place. Then, on 400 BC, Hippocrates, the father of medicine, mentions treatment of headaches, arthritis with electric fish. So they were using these electric fishes for therapy, and that's why they are called in Greek narki. Narki, okay? We say narki is the mine, actually. In Greek, narki is the mine. When you step it, you explode. And that produces numbness. That's where narcotics came from, because you become numb when you take drugs, narki, narcotic. And in the Latin version of it, it is the torpedo. So you have been learning a lot of Greek. You don't have any, You're learning a new language today. So let's go to the medieval times now. We have in the Arabic medicine people using it for epilepsy. It's important, epilepsy, melancholy, headaches, vertigo. Okay? And then we have in Ethiopia, they are using it in the medieval times. And what it says here, the actual statement, the virtue of the fish will dispossess a man of the devil himself, as reported of electric catfish in a Jesuit's account. I'm rushing this because I don't want you don't care about this, you care about the essence, and the essence is the electrotherapy now, which is used with produced electricity, not natural electricity. In England, we have John Wellesley, where he published the book Electrotherapy, in which he was treating headaches, abdominal pains, hysterical disorders, epilepsy, deafness, blindness. He considered the electricity striking at the root of the disease, as we all say now, and so on. In 1769, Thomas Dyer recorded a case of diabolical disturbance at Hillgrove Street, Bristol, which was lasted several years. And they used electrotherapy to dispossess that girl. Another one in Germany is saying that he's using electricity because he was possessed by 7 devils. Okay? I'm rushing this. All this information is in the book. Don't waste your time writing down. It is in the book. If you buy the book, it's all there and much more than that. This is just a selection. This is the important part. Now, 1918, First World War. Do you remember the people were fighting in these big trenches and the bombarding was something unbelievable. So they called it at the time war neurosis or shell shock. It was evidenced by the rapid recovery of patients under severe electrical treatment, as recorded at that time by Dr. Williams, acting medical director in New York. He suggests that obsessions or possession by spirits of dead soldiers, unconscious of their transition as the exciting cause. This is indicated by delirium, hallucinations, anxiety states, functional heart disorders, paralysis, tremors, gait disturbances, convulsive movements, pain, anesthesia, hyperesthesia, blindness, and disorders of speech. The spirit hypothesis, which we were talking on the first part, regarding war neurosis is further evidenced by the rapid recovery of patients under severe electrical treatment as instituted by Dr. Vincent, who Dr. Williams stated would cure in a few hours patients who had been in the care of other psychiatrists for months. So this is really a very interesting account. And then comes the blockbuster, not blockbuster, it didn't sell any books, but it's really interesting, 30 Years Among the Dead by Carl Wickland. The case I explained a while ago. And then we have Dr. Yap, a psychiatrist in Hong Kong. He made a whole publication about the possession syndrome in the Journal of Mental Science. And he actually said that electroconvulsive therapy, electroshock therapy, must have been successful in some cases because some spirits were driven out of the body of the owner. So here are some statements by our friend Wickland. During 30 years of indefatigable research among the dead, such startling conditions have been revealed that it seems incredible intelligent reasoners, along with other lines of thought, could have so long ignored the simple facts which can so readily be verified. He also said that although this electricity is harmless to the patient, it is exceedingly effective for the obsessing spirit, which cannot long resist such electrical treatment, and so it is dislodged. If the reason that electroshock therapy sometimes worked very successfully with severely depressed patients was not the same process, the possessing spirit was shocked out of the body of the patient. If a soul is in a body, not its own body, it should be released for its own good and that of the host. Yeah, you see my eyes are. The original soul is the only soul in almost all cases that has right in that body. This is Dr. Ireland Frey from 1999, also an excellent book. Now, this is an interesting story. Give me my liver back. Now, my brother-in-law had a cousin who was an Orthodox priest, and he had a problem with his liver. He was going to die, so he went to Paris, because in Athens there was no chance for him to be alive. And he goes to France. In France, they attempted, that was either the third or the fourth such operation that took place at the time. they did a transplant of a liver. They found a compatible liver from a Spaniard who had died in a car accident in the borders of Spain and France. So when they anesthetized him, when he was under the influence of anesthesia, he sees himself out of the body, and he sees the doctors, opening up his body and taking out his liver, and he sees the other liver being brought in to be put inside. At that time, a guy with gray hair, short hair, big, how do you call those? Sideburns. Big ones, comes to him and says, "Give me my liver back." And he is really very, "Give me my liver back." And he's really upset. And he says, "Wait, this is now you, what? Wait." And they started a discussion for hours. "Please, I'm going to die." He didn't know anything, okay? That was now, he's under anesthesia. But he finally convinced him to let go of his liver and let him have it. When I heard that story, and I was hearing, people giving donors and organs, I said, no, I will never give an organ to anybody, because I got scared as hell out of this story. That was 20 years ago almost, in 1994. But that really impressed me and shocked me at the time. But this is another interesting story which I have to tell you, to see with you.
First and foremost,
is our heart just an organ to pump blood, or could it be much more? The first patient to report a change in personality was Claire Sylvia from Boston in the United States. 20 years ago, she was the first person at New Haven Hospital to receive a heart and lung transplant. The operation was a success.
It was very weird to see my heart on the machine, giving me the beat and hearing it. It was a whole new rhythm, a whole new feeling. And little did I know that my journey was just beginning. It was a couple of days after the surgery that the press came in to interview me. And one of the reporters asked, "Now that you've had this miracle, what do you want more than anything in the world?" And I said, "I'd die for a beer right now." It just came from me, and I'm not a beer drinker. And I was a little mortified by my flippant answer to such a profound question. So that was my first happening. And little by little, many things started happening till I was really feeling convinced that I was living with the presence of another within me. The first thing that happened were the food preference changes. Suddenly, like green peppers, finding them, putting them in my food, I used to take them out. And the first time they allowed me to drive, I found myself going to a Kentucky Fried Chicken place to buy chicken nuggets, something I never did before. I found that my handwriting, instead of going from right to left, it was going from left to right. And these things were sneaking up on me, little by little.
Like most heart transplant recipients, no detail was revealed to Claire about her donor. All she was told was that her heart had come from a young man who had died in a motorcycle accident.
It wasn't until a few months after the transplant that I had a dream in which I'm with a young man. I awakened from the dream feeling that this for certain was my donor. And in the dream, his name, I knew him as Tim L. So I called the transplant coordinator, told her about the dream, and asked her if that was his name. Well, there was a moment of silence, and she said, "Please don't pursue this."
Remarkably, the donor's name was Tim Lamarand. What's more, he loved beer and green peppers. Chicken nuggets were found in his motorcycle jacket when he died. It was only when she finally met her donor family that she pieced everything together, giving her confirmation that everything she was experiencing had extraordinary similarities to her donor.
The family of my heart verified all the experience I was having, and they were hungry to get anything they could from me about Tim that I was remembering from his memories that were coming through me.
Claire was the first case to appear in the public eye. The memories and changes were uncannily like her donor. With strict codes of confidentiality in place at the hospital, it was impossible for Claire to have known these details about her donor. So where could these memories have come from? Professor Paul Pearsall is a cardioneurologist from the University of Honolulu.
So Professor Paul Pearsall, what is he saying? He's saying that the heart has the ability, and it has a whole neuronic system of its own, a nervous system of its own, and that it has the ability to contain memory. What I'm saying is that the spirit of this unlucky young man just jumped in and followed his heart and went into Mrs. Sylvia. That's my interpretation of the case. I may be wrong, of course, but that's my interpretation. Actually, as you heard her already, I will read that out for you. It almost felt as if a second soul was sharing my body. That's from her book. So, yes, well, that's an interesting story as well. A very interesting story, I would say. So, why am I talking about these things is because when I was a young boy and all the way I grew up, if somebody had an accident, if they fell off the thing, or I would laugh. I mean, they would fall down, they would slip, they would have an accident, and my lips were going like this, laughing. But my training, my education, my raising from the family did not allow room for such a thing. And it was really bizarre. Why am I doing this? This is really strange. And not a lot, but 2 or 3 friends, good friends of mine, had located that and had said, Nassos, what are you doing? I said, yeah, you're right. Now, one day I was sleeping with a girlfriend, and while I sleep, I woke up and I started pointing my finger to her and I said, you will never do it. And I was threatening her. She got so upset. She said, what is this? She went away from the bed. Well, I did it in 1 girl, I did it in 2 girls, I did it on 3 girls. That was strange. Who was there doing this? I will tell you a bit of the story in a while, but it's interesting that there are more extreme things than you can imagine around. So let's take a look a bit about them. And
I was just locking the door again, and he had another one, and he ran and hit the door, and the door was still locked, it flew open. So then I just got rid of stuff in front of the door. He's got it to where it won't lock. You just close it like that, and you pull it back open. So I have to pick up on it and make sure it's locked. So I pull this lid like that. And I pull this up against it like that, and that way he can't come in. Yeah, he hasn't noticed it. When he hits the door now, it'll crack like that much, as far as he can get it. go fleeing. And you have to protect yourself when you go to sleep.
Unable to afford medical guidance, Monica and Cody grew fearful that his attacks were being triggered by an external entity. We arranged for Cody to be seen by a sleep clinic, explain his nocturnal awakenings.
This is the most extreme case of sleepwalking and night terrors that I've seen. These have been reported in others. This is the first one that we've had here at our center for this magnitude.
While Cody spends a few nights at the sleep lab, doctors will study his brain activity and muscle tone, as well as record him sleeping using infrared cameras and sound monitoring equipment.
If you need anything at all during the night, the intercom will be on all night. Don't hesitate to let us know. Okay? Okay. All right. Good night.
During the first night of monitoring, Cody appears to wake up, terrified. The EEG machine shows that he is still in deep sleep and not dreaming. Cody isn't dreaming. What could be provoking him in such a way? The next morning, Dr. Davila studies the tape.
You had an awakening there out of deep sleep, but your eyeballs are moving, and you look pretty scared there. Do you remember anything like that? Don't ever remember nothing. You don't remember being in a nightmare or having a dream or on that particular night. And Monica, have you seen him show those eye movements in the past, or has he opened his eyes?
No, I usually don't wake up till I'm on.
Okay.
It looks wicked to see my eyes open like that. Just don't look like me. Really.
His eyes are darting around. It's hard to know whether he's actually seeing anything or not. He doesn't have any recall of opening his eyes. He doesn't have any recall of seeing anything frightening, although he looks frightening. In Cody's case, we cannot find a specific trigger, so he is a mystery in that sense, and we cannot determine what is going on in his mind. But in his case, for some reason, he is fighting to get into wakefulness and alertness, and literally fighting his way into that.
Dr. Davila believes Cody is suffering from an extreme form of sleepwalking that occurs during the deepest stages of his sleep. But what Cody actually sees, or why he is driven to such violence, still remains a mystery. Whatever the medical explanation, Cody is still no nearer to understanding what causes his attacks.
They haven't gave me a reason why I do it. They haven't told me, they don't know why I do it, what causes it. All they know is they can put me on medication and maybe it'll stop it. And, I hope it does. I hope I can take some medication, go to sleep at night and rest. And don't have to worry about hurting anybody, I hurt myself.
Cody has now been taking the medication for over 3 months. Although his attacks have reduced in number, they still occur, and are as unpredictable and violent as ever. For many who suffer from nocturnal assault, their testimony is evidence of an experience that is still not fully understood.
I've seen lots of different explanations offered of the scientific explanation of this. In general, and in fact all of them that I know of, do not fit the data of the experience well. Now maybe someday people will be able to get to the point where they really do fit well. But I do think that it's not fair to people's experience and people's understanding of this sort of thing to take a loose sloppy, hypothetical, scientific explanation and figure, well, at least it's scientific, we ought to accept it. No, that's not right. It ought to really account for what needs to be accounted for. None of them do yet. Good luck, everybody. Keep working on it, but let's not claim that it's been done.
Whether or not science will one day offer a full explanation for these nocturnal attacks is unclear. What is clear is that those who suffer will continue to live in fear of what lurks on the other side of sleep.
So, what would you think that happened? What would be your explanation for this phenomenon? Let's start the other way now around. What would you think that this was? No? Excuse me? That would be, yes, that would be the reasonable explanation probably. Excuse me? That's my assertion. It is possession. Listen, it is impossible by medical terms, a person who is in deep sleep, we are not talking about REM, we're talking about deep sleep, in theta level. It is impossible, absolutely impossible for him to move or to do gestures or to attack. We had a long discussion with many medical doctors who were, especially an Indian one, who did a long study on this. And when they figured out that, they had to accept that there must be some such explanation. Of course, that's an attempt for an explanation. But here I'm trying to make a case. I'm just building blocks and blocks of the case. I'm just doing that to show you the dimensions of things that can happen to us. So, sorry. Oh, gender dysphoria. Here we are. We are getting to the picture now. Do you know what gender dysphoria is? The body, it is, dysphoria is a Greek word again. You see, you learned a lot of Greek words today, which stands for those people who have problems dealing with their sexual identity, okay? I mean, they are male, but they feel female, or they are female, and they feel male. So it seems as if a soul is in a wrong body, or vice versa. You can put it as you want. The point is that we know of extreme cases of transsexuals or from people who have had sex operation and they have changed their sex. What is that makes them do that? It is a really interesting case. So this nice image I found on the internet, I mean, this is a man and he looks himself in the mirror and he sees a woman. I don't know if you can see that clearly, okay? And this, of course, here was a gentleman, and now he's a lady. So, the past life issue you said a while ago, okay, here is an explanation. It says that the common occurrence, of some gender identity confusion among the subjects of sex change cases that I have studied allows me to suggest that perhaps the condition of other persons afflicted with gender identity confusion and also homosexuality derives from previous lives as members of the opposite sex. This might occur even when the person concerned has no imaged memories of a previous life. That's Dr. Stevenson from the University of Virginia we were talking about in the first part. So that is one explanation, that the soul at the exactly former incarnation or for many consecutive incarnations was female, and suddenly this soul finds itself in a male body. That is one explanation. The second one, though, is this. What cannot be denied is that a patient who was very clearly a transsexual, by the most conservative criteria, assumed a long-lasting masculine gender identity in a remarkable short time following an apparent exorcism. Now, Dr. Barlow wrote that back in '77. He showed, he had a patient, this story is fascinating, it's absolutely unbelievable. At that time, for them to make an operation and change the sex, they were doing all kinds of questionnaires to make sure that that person is ready to jump to the other side, to go to become the opposite sex. And actually, they were using a lot of hormones to change the hormonic levels. Okay? So, this doctor was fighting for this for more than a year. And all of a sudden, this guy disappears on him. He was almost, the breasts were coming out, and he disappeared on him. Well, after 6 months, he was at a restaurant eating, and there he sees him as a waiter. And he is fully masculine, absolutely masculine. And he tells him, why are you like this? What happened to you? He says, I went, my boss here, he didn't like that I wanted to change my, and he went me to the church here, and they performed an exorcism. And during that exorcism, 22 entities went out, and one of them was a female. Now, this doctor, the professor, and that's great for him that he did so, made the whole publication at the time, and he risked his position at the university. This was really very risky, what he did at that time, back in the 70s. Then we have, again in the 70s, we have Edith Fiore, psychotherapist, who says in '87 in her second book, she says that every homosexual patient I have done a deposition on has had at least one exceedingly dominating entity of the opposite sex who was determining the sexual preference. Often, those patients told of feeling they were trapped in bodies of the wrong sex. Now, bearded lady. When I was in Corfu, a beautiful 19-year-old girl, a voluptuous, very sexy beauty, lived there in the block of apartments. Then her mother died. She had schizophrenia, and she died. And she was an orphan from a father, and she had to raise her younger daughter, so she disappeared from that area. I don't know, she was working in hotels and such. Corfu is a resort area in Greece, and she was working, part-time, full-time in the summer and part-time in the winter. Anyway, as I lost track of her. One day, a friend said, a client of mine actually, he said, Nassos, could you take care of a girl that I'm really interested in, and she's in deep trouble, and I will pay everything as far as the sessions are concerned. I said, okay, send her in. She comes in, and I didn't recognize her. I saw a fat lady with a lot of hair here. She almost had a beard like Richard. Ugly, and everything was deformed. And I said, oh, Nassos, how are you doing? I said, who is this? And she tells me her name. And I said, I couldn't hold myself. It was very difficult for me to control myself and my feelings. But then she said, do you see what happened to me? I said, yeah, I sure do. Lay down immediately. I went in trance with her. I put her into trance. And It took me many sessions, but in, I don't know what number of sessions, I think it was either 4 or 5, a masculine guy comes out and he says, I'm not going out. Oh, yes, you are. You are going out. Not, I'm not going out. We have a severe fight, and I use my electro acupuncture device, and I kick the hell out of him, and he goes away. Okay. In 2 months, 1 month, I don't remember now exactly, but it was several weeks after that incident, this girl had lost all the hair from her face. She was back beautiful as she used to be. Now 24 she was, and very nice looking. She lost at least 25 kilos in pounds, 40 pounds, 50 pounds, I guess. She lost a lot of weight, and she became a woman again. Now, when she went to her doctor, the endocrinologist, he said, that cannot be. Where did you go? How did you do that? When she said, well, I went to a hypnotist, oh, he said, okay. That's not done, something else, you did something else, and you went to another doctor, and you don't want to tell me. And he dismissed the case like that. So the bearded beauties, this is a lady, as you see, it's an American lady. This is an older picture, 100 years back. Another woman, she's a woman. Okay? Now, of course, you can say it's hormonal. Of course, you can test the testosterone and it's high. But what makes it high? What raises the level or what lowers it? That's the question. Now, another interesting thing. Phantom limbs. Okay. I am at a hospital. A cousin of mine had fallen down with his, the one I was telling you about, the roof we were making, and at lunchtime. He fell down with his motorbike, and he was hit, and so we had to go to the hospital. And I went there to the hospital. And as I am at the hospital, there is a guy in deep pain right next to him. There were 8 people in that room. And that guy was really hurting a lot. And then he said, oh, my how do you say that? My soul is itching. Oh, please. He was not from Athens, he was from a place away, no relatives were there. So he said, please, can you scratch my soul? Of course. So I scratched his soul, okay. And I lift the shit. And as I look down, there is no foot. There's no foot. I get shocked. He doesn't know that he doesn't have the foot. He's lost his foot. So I go to the one he has, I do this. And he says, not this one, the other one. Okay. And I do this. I assume where the soul would be. And I say, okay, more, please, do that more. And I was doing that. And he was relieved. What is this? I was shocked again, once more. So then, when I started doing this profession, I ran into bibliography, which is relevant to phantom limbs. Let me find it in the book, because this is really something. And I don't have it here. Yeah, here it is. So an excellent account is by Rupert Sheldrake, but I will read you this. A man who had a finger amputated and preserved in a jar, okay? The man was okay for several years. Then he went back to his doctor, who had amputated his finger, complaining of a feeling of extreme cold in the missing finger. The doctor wanted to know where the jar with the missing finger was. The man told him it was in the mother's heated basement, where it has always been. The doctor told the man to call his mother and check the jar. The mother didn't want to do that, but did, and found a broken basement window a few inches from the jar. As soon as the finger was warmed up, the pain left. Okay? That's a real account. There are many others, of course. I'm just telling you that what Samuel Sagan is saying is that people are completely unaware of the great harm they can do to themselves or to others when manipulating what they regard as mere pieces of flesh, but which in reality sometimes carry extremely noxious energies. So, here is another interesting case. Apotemnophilia. Don't tell me it's Greek again. It's, in English, it's called body integrity identity disorder. Okay? So, here you will see something else.
The story on today's show could be the most bizarre story we've done in our 15-year history.
To laugh a little, eh?
This really crazy. My guest began wearing women's clothing at age 12 and became a transsexual at age 35. But that's not the unusual part of this story. No, this transsexual also decided at the age of 14 that she didn't want her legs. So 1 year ago, she took a saw. Why don't you hand me that? Here, hold it. Oh boy. Okay. All right. From now on, who doesn't think I'm funny? All right. So 1 year ago, she took a saw just like this. And she cut off, this is true, stop it. She cut off her own leg. Let's meet her. Here's Sandra. Sandra, Sandra, what? Okay. What's going on? This is strange, isn't it?
Yes, it's strange.
Okay. So how old are you now?
I'm 48.
Now you're 48. When you were 35, you decided to become a woman.
Mm-hmm.
Okay. That's fine. At what age did you think you didn't want your legs?
At 14.
At 14. When did you actually cut them off?
I cut this one off in 2000.
I thought that one went through. Yeah. Okay. Why did you cut your leg off?
I didn't want them. My brain just kept saying get rid of them, so I had to get rid of them.
When you became a woman, did your brain say get rid of something else?
Yeah, but I couldn't cut that out.
What kind of things have you done to get your legs?
I've injected my knee with my feces, 120 cc's under my kneecap, just liquefied, pump it in. I've cut myself with razor blades. I've drove nails in the bone. My brain would just say, get a 16-penny nail and a hammer and drive it in the bone, and I just drive it in the bone. I built the guillotine. I dropped it on my leg. That didn't work. So, you know, I was like, go back to the drawing board. I got to figure out something else. I cut the circulation off up here above the knee with a radiator hose clamp to put on the automobile.
Yeah.
And then down here, I've used like a pantyhose with like a release on it to make it real tight. And then I just got my saw and got everything in the kitchen, got everything ready that I needed. And got up on the counter and waited till the leg went numb and turned purple. And I got the saw and I put it on my leg and I powered it up and I set it off and laid it on the counter. And I looked at the saw and looked at my leg and said, well, it's down or never. And then when I grabbed the saw, put it on my leg,
Were you
powered it up.
screaming?
Mm-hmm.
Were you drinking?
No. A little bit. Mm-hmm. Never did pass out. And they didn't pass out afterwards.
You didn't pass out.
Calm and cool. My friends got there, they was all in the circle. Oh, you going down, you going. I'm like, shut up and go call down this week.
How did you decide after you did one?
Because I hadn't wanted both of them, neither one of them since I was 14. So, you know, I couldn't tell somebody I didn't want both of them. I just said I didn't want one. I figured they'd really think I was nuts. I didn't want
Oh,
one.
no, now they think oh, no, there's no way they think you're nuts to settle up one leg. Now, one's a little longer than the other.
I could leave it on for quite some time. It's interesting, but I'm trying to make a point here. I mean, okay. This man he was dressing in women's clothes from 12 years old, okay? He wanted to change sex. And he didn't like his leg. Something was telling him, get rid of that leg. There are people that went on the train and placed the leg there and the train passed over. There are people that went to doctors and they paid them and they amputated them in England. There are people that did that in Holland. So it's really strange. It's very rare, but it is the exceptions that we have to look into if we want to really find something. And even though it's rare, it's real. It's there. And as William James was saying, you only have to bring one white crow to disprove the theory that all crows are black. Just bring me one white crow. I bring you a lot of white crows. Right now, I bring you a lot of white crows. What I'm going to say is that this guy was dominated by an entity that wanted to control his life and to destroy it. We can only see this from the consequences, but actually, it is this possession, I don't know of what entity, but I assume that it is at least malevolent. It's the best, the least emotional word that I could express for this. So now, when I take an interview and I find a person is really in trouble, I do all this questionnaire. The reason I do it, and you will read out the questions at your home, you will keep them at your home, is that I'm trying to do a thorough questionnaire to make sure that I have something that could be possession and not a physical explanation. It could be a spirit attachment that is causing the trouble to that person that is in pain and not something else. So in case I find this, I go over that and I start asking all these questions. Usually I do not do it openly. I just take an intake, but I throw this question out and the other question, and it comes on naturally. Now, if the score is too high, I suspect that there must be something attached. But again, that is not enough, and I will never proceed to a depossession or a release of that spirit if I'm not, I was not sitting properly, if I'm not certain that he will lead me there. What I'm doing in trance is I'm waiting for the client to go to the root of the problem. So, the way to do so is to let the session proceed, and when I sense that something is going wrong, that the images that are coming through are fake, or they are demonic. What I say demonic, they see clowns, they see puppets, they see ugly things, they see darkness, they see gray things, they see cold, they smell foul. If I see these things, I know I have something preternatural. It is something really bad. So I'm really cautious of how I will move. Or if I have something that looks like a regular regression, it is a regular regression, but they don't want to go to the death scene. or they do not go to the phase of life between lives, then something is wrong. So when I have the feeling that these people who are under tremendous stress and have problems, and the session is not evolving correctly, all these are laid down in the book, okay? They are very, this is only for therapists, mostly. I do this, I knock on their sternum here, okay? And I say this question: whence came you into this body? Now, if there is a possessing spirit, it goes, oh, I'm caught. The whole face of the person in trance is changed totally, and oh my God, I'm caught. They caught me, I'm trapped. That's it, I cannot go away. I cannot go away anymore. So at that point, when I see terror, I know I'm on the right track. So then I will proceed with releasing the entity. The procedure is a very long, a very strenuous procedure, and you have to be really friendly with this entity, because, you see, who is going to jump into you? Who is going to walk in? What's your name?
Jeff.
Jeff. Who is going to walk in you? Well, I will tell you, it's going to be either a drunk guy, an addict, a guy who was killed in an accident very young, a person that has been addicted to things. That is the most possible entity that will jump into your body. Okay. Now, if that person jumps in, you will have the bad luck like Claire Sylvia a while ago, that you will be eating chicken nuggets and green pepper and you will be drinking beer. He will change your behavior. He will send you to do the nastiest things you could do. I mean, suppose you are very well with your wife and you're married and you love her and all that. If another guy jumps in, he may want to go with this, and with this, and with this, and suddenly you were a nice guy and now you go out with 10 women per day. I mean, you can see the difference. Of course, there's always a tendency. That doesn't mean that the intention of the possessing entity can really do that, because you have a moral code, you have an ethical code. I mean, you may have the tendency to do it, but something stops you. That's why I have a question there, and it says, has there been any time that you think that your thoughts are not yours? I stated something like that. I don't remember now exactly how I say it. But the reason is this. Many people say things or do things, and they say, did I say that? Did I do that? That's not me. That's certainly not me. That's wrong. I've never done that. Why should I think of that in the first place? So, you get my point? I've met a lot of people in my life, in school, in college, in my sex life, who were doing bizarre things and doing crazy things. And I said, why is this happening? Why this woman is like this? And they change from one moment to the other. I mean, immediately, the change is like that. It's so abrupt, you cannot sense it. So this, whence came you into this body, was recorded by Lucian. He was a Greek historian of the first years after Christ. And he says this story. So I'm just going to read it out for you. I should like to ask you then that you think what you think of those who deliver demoniacs from their terrors and who publicly conjure phantoms. I need not recall to you the master of this art, the famous Syrian of Palestine. It was not only Christ. There were other people doing the same thing. everyone already knows this remarkable man who, in the case of people falling down at the sight of the moon, rolling their eyes and foaming at the mouth, calls on them to stand up and sends them back home whole and free from their infirmity, for which he charges a large amount of money. When he's with sick persons, he asks them how the demon enter into them. Okay, whence did you come into this body? The patient remains silent, but the demon replies in Greek or a barbarian tongue and says what he is, whence he comes, and how he has entered into the mon's body. This, the moment chosen to conjure him to come forth. If he resists, the Syrian threatens him and finally drives him out. So, this is just a real document, 2,000 years old from that time. In a number of cases, persons whose condition would ordinarily be described as due to hysteria, dual or multiple personality, dementia precox, paranoia, or some other form of mental disturbance showed unmistakable indications of invasion by foreign and discarnate entities. That was Professor Hislop back in the 1920s. Are there any fundamental common denominators in the chiefly innocuous examples of possession I have quoted? One thing stands out above all: the split-second nature of the intervention of the possessing entity. There is no build-up before the takeover. One should note that in the cases noted, there is no awareness at all on the part of the subject of having been taken over. So they don't have the awareness that they are taken over. And this happens like that. Another professor, a German professor, wrote, reviewing the series of cases, their first and most striking characteristic is that the patient's organism appears to be invaded by a new personality. It is governed by a strange soul. This is what has given to these states from the earliest times when we can observe them up to the most recent, the name of possession. It is as if another soul had entered into the body and thenceforward subsisted there in place or side by side with a normal subject. So, I just made a very brief introduction to what I have written in this book. In case you want to purchase this book, you go to the A.R.E. bookstore and you can purchase it. It's far more detailed, and I have a lot of cases from my, around 10 cases from my practice. So it's really interesting. If you are interested in this, it's easily read, even though it's so difficult a concept. So now, I'm open to questions. Let's, yes?
I'm curious about the difference between a spirit entering the body and the DNA in a transplant.
Yeah. You see, the title is Explorations in Terra Incognita. What I'm saying here is this land is unknown, okay? It is uncharted territory. We do not know when and what is happening exactly. What I'm saying is just to study it. It could have been, of course, the neurons of the heart of the donor that are imposing, so to say, the memories on the recipient. But we have to then to accept that memory is is stored in a way, either in a quantic level or in some other level, which we cannot define right now. if you ask any scientist, any neuroscientist, neurosurgeon, they don't know where the memory is kept. They have no idea. If you really insist on them, they have no idea. Actually, they have no idea what happens in the brain. They are really, I mean, they have reached the moon, we are going to Mars, we have done a lot of things, and we have decoded DNA. But actually, DNA of human, you remember in '99 the race, who is going to publish first the DNA code, and do you remember the two schools that were fighting? Okay, they were saying that 100,000 genes. Well, finally, it was 25,000 genes. The doctor will tell us better, I don't remember. They were just as few as a chimpanzee. But we are not chimpanzees, we are humans. There is a difference. What makes the difference? What makes it? Well, it is so similar, our DNA code, to a monkey, that what makes the difference? It's not the DNA. This DNA determinism, it's the new armament of materialism, okay? And I'm always saying, prove what you have to say. Now, they say the supergenome theory. I mean, they did realize that the genome theory did not work, so they invented now a new idea that there is something above the genes that is controlling them. They are led also to this same, but they are not naming it. They're not naming what that supergenome theory. There is a very good documentary. It's called Supergenome Theory, I think. Very good documentary. It's up on YouTube. You can upload it. You can see it on YouTube. I have it also here in my files. Did I answer your question? No.
Well, it expanded my mind a little more. But so you're saying there's no way of defining which it is?
Yeah, I'm on the other side. I'm suggesting that it might be, I'm not saying it is, it might be a spirit position. Excuse me?
It might be the DNA.
It might be the DNA also, yes. I cannot exclude one from the other.
Okay.
Now, it could have been both. Yes, please.
Are you going to talk about how to do the rapid release?
How to do the
rapid release of the entities?
Yeah, okay. Well, that is explicitly said in the book. How do we do that? We put together all these things that I just said. I employ the electricity on the people that are in trance, and I have discovered that they are under possession. And when I do that, and I employ the electricity, the person goes, the possessor actually, the obsessor, goes like this, stop, don't do that. And when they do that, they say stop, so you start a negotiation. The point is not to kick him out. The point is to make him understand his condition. The point is to make him understand that he is a man in a woman's body, for instance, and he should not be there, and to realize that he is dead, that he died one day, and instead of going up to the light, he remained hanging around earthbound, and in the first case that was there, he jumped in a person and he walked in. So he is a walk-in, and now he cannot go away because he is kept from the gravitational condition. So you remind them of how they were, and you have to tell them, to tell you what they did before they entered into the body of your client. You have to ask them, what is happening there? And they usually tell you. They usually tell you, well, it's amazing, the stories that I've written and the stories that I have not written. In the second edition, I will add a lot of stories. What they tell you of how the condition is in the lower astral planes. okay, where the soul has departed, but it doesn't want to go up, either because this guy is afraid of judgment, okay, of his deeds. He may be a very mean person that doesn't want to be exposed to the powers of the light. So stays here in the lower astral and jumps into the first victim. The question that I asked, had you ever had total anesthesia, a surgical anesthesia, is for this reason. Your aura breaks when they make a surgery on you. Anyone can jump in you at that time. Okay? I don't want to scare you. I'm saying that sometimes we all have protectors, but it is a good thing before you go to surgery to ask your sacred powers, the protector beings, to come to protect you, to make a seal, so nobody will jump into you. That's why I ask this question. Or if there are people who are doing a lot of excess behavior, obsessive behavior, they drink too much, or they smoke too much, or they are too much into drugs, or they oversex, or whatever. They do nasty things. They are obese, absolutely. They are. When you see something beyond the median range, keep that in mind. Like, especially when you see sudden changes in a friend. Have you had a friend that, I mean, there is a Suzak syndrome. Suzak syndrome is a syndrome when people come out of anesthesia and they don't remember anything, and they speak a foreign language. Suzak syndrome, that's what it's called.
Could you spell
Okay.
that? Could you spell the Suzak?
Suzak, S-U-S-A-C. Suzak syndrome. Okay? Do you know the phenomenon of xenoglossy? We didn't talk about it. I had it in the first part, but I didn't. Now it's time. Okay. Xenoglossy, again a Greek. Sorry for that word, means being able to speak a foreign language without having been taught this language. You have never been taught that language, but you speak it. So xenoglossy, and specifically responsive xenoglossy. Listen, okay, suppose I'm watching a movie in Italian, okay? I'm a very good in memory, and I recollect, I absorb that information. And when I'm in trance, I take Marcello Mastroianni and I say it out loud, okay? That's fine. That would be cryptomnesia. Cryptomnesia is something that I have seen or read or experienced. It is forgotten. It is somewhere in my hunchback, okay? And now that I'm in trance, it comes out and it speaks itself out. Okay, that could be xenoglossy. But responsive xenoglossy means that you speak Italian, you have not ever been taught Italian. We check on your records and we find that indeed you have never been taught Italian, which is sort of impossible, of course. But when I ask you Italian because I happen to speak Italian, you start responding to me coherently. So I had a lady at my as a client who spoke Italian. She found her former life in Venice and started speaking Italian. I don't speak Italian, but I brought a professor from the university. The next session, I brought a professor from the university to speak to her, and he spoke Italian to her, and indeed they had a conversation in Italian. Okay, so that's responsive xenoglossy. And I asked her, did you ever study that? No. Did you ever study Italian? No. But she could speak fluently and very well. Now, this is xenoglossy. But there is another version of it, glossolalia, which means that it resembles a foreign language, but neither the subject nor anybody else knows that language. I mean, is it a language or is it blah, 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 blah? Is it a real language or is it a making up? So that is glossolalia. That's different. I've seen a lot of people doing that. I don't care about that. I disregard it because I cannot examine it. But xenoglossy, I can really, really study on that because that's something you can really work on. Another question? Yes, please.
In so many cases, as working as a therapist, if the person who is under hypnosis now is speaking another language, couldn't it also mean a past life in that other
Yes.
country? Would it necessarily mean that entity?
No. I'm not saying that that is necessarily possession. Yes, you're right. No. Yeah, there are two dimensions in this. It is either a skill that had been acquired in a former incarnation, or it has been an aspect of possession. Ian Stevenson, again, that great professor, wrote a book which is called Unlearned Language. It has two cases. One is a former life and the other is possession. And they are under control in laboratory conditions. It's absolutely interesting. It's really convincing. Yes?
Don't they usually explain some of the transsexual people having an X or a Y chromosome, like genetics are a factor?
Yes, for some of them, that is true, but not all of them. Not all of them. So, yes, you actually add to the question our friend did a while ago. There you go for the DNA theory. In the other cases, though, you cannot go for the DNA theory. You see, okay, there's another explanation for this. Do you know about the twin eating syndrome? Well, you see, sometimes they have found in operations that they open up and they find another body inside, okay? Real body, not a spirit body, okay? It is the twin that was in the mother's womb, and they fought with each other, and the one devours the other. I had a case of a British woman. She was the survival of such a fight in her mother's womb. It's amazing because Sueli Simoes from Portugal made an excellent presentation about the twin syndrome, and I said, "Oh my God, yeah, I'm not alone to have that case." It's interesting what happens there. It's interesting. Let me tell you. A lot of women have fertility problems, and they go, and they do all kinds of this new technology thing, and they cannot get pregnant, no matter what. Had you ever thought that interference with fertility could be due to spiritual interference? I was called as a godfather for 5 ladies with 1 or 2 sessions. As a godfather, they called me in because they were pregnant. After thousands and thousands of dollars that they had spent, they came there in total desperation in their 40s. And they became pregnant and they have healthy children. Why? Because there was somebody there. I'm thinking of writing my second book on these 6 cases only, just a little booklet, on these 6 cases only. It is amazing what an attaching spirit can do to kick out any possible embryo. They can cause whatever you can imagine. They can cause accidents. They can do unbelievable and impossible things that you cannot even imagine. I mean, I wish I could remember all the sessions I have done, because those are stored somewhere in my mind now. but I record and I videotape every session. I used to, at least. Now I record only the sound, but I used to record, and because it is good. Sometimes, you know, all this material has to go somewhere. It is good to know what happens and to run back, because when you run into a strange situation, you do not have the tools at the time to deal with it. But then life brings it that way that you can find those materials and study. Did I answer a bit? Yes, please.
When you are having a conversation with one of your clients' entity, that's
The attaching entity, yeah.
attached, what protects you from that going inside you?
I don't know. Listen, I've have a strong feeling that I have a protection from a very young age, let's say. Of course, I was vulnerable because I had a possessing entity by myself. I didn't tell you about that. Yeah, I forgot to tell you that. Well, the guy who was laughing when finally came his day to go away. I could not heal myself, so I asked my partner to do that for me. So she did that from a distance. I mean, she did that. She went in trance on behalf of me, okay? And she fought that guy. He was a Venetian, a judge during the Inquisition time. He was a really nasty guy, a very nasty guy, who was actually possessing my body, and he was cohabiting with me. After some trouble, he got out. That night, I had a colic on my kidneys, and severe pain, and a lot of diarrhea at the same time, and I had vomiting. The spiritual catharsis is not only in the spiritual level. It has also its physical counterpart. I mean, you will have to go through this phase. And I've seen a lot of, I don't tell them, I don't want to you know, suggest in a way that, when you go home you will vomit. But usually the other day they call me, I have a colic, I have that. Okay, do whatever you have to do, let it go, it will go. So, what protects me is the question. I don't know exactly. I'm sure that I have a guardian. Call it an angel, whatever. She is, it is, I don't know. But I feel that when something wrong is going to happen, something stops me. I mean, I'm at a street, and I know that he has the stop, I can go on, and I stop, and the car goes like that. And I miss him by this. Who stopped me? Somebody stopped me at the time. So if he stops me there, he can protect me also from these entities. Well, I have faced demons. I'm not facing only humans. I faced demons. The last case in the book is something that has not been done in 2,000 years. I asked that entity to come out of the body of my client after a very, 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 very long and torturous series of sessions. And I did it in a mountain, and I had a jug of water, a big one, 10 liters. It was a big jug full of water. And I put it on the top of a building. And when we did that, I said, you go out, and when you go out, you throw that fucking thing down. Otherwise, I will make you disappear. And I have 5 witnesses that were with my client at the time. He jumps out, an awful smell comes out of the mouth of my client, He tries to get into another person who was in the company. He cannot do that, and then he's really upset, and he throws the jug down. And he breaks the jug. Now, how can a spirit throw down a 10-liter jug, which was actually weighing 20 kilos at least? It fell down, and it broke. Christ had done that. The Palestinian, I read about Apollonius of Tyana. But from there on, nobody else has done that. Or I haven't heard of anybody else. I'm saying that it can be done. I'm saying that if you want, you can do it. And it works. And thank God I have witnesses for what I'm saying right now. Another time, I used my electricity here. A friend of mine who was my roommate in Oklahoma, the University of Oklahoma. He was really something. He would never do, he was the definition of procrastination. Is there a definition for it? He is the one. Okay? Okay, let's do this. Oh no, let's do the other. Let's do this. No. He never did anything in his life. He could not finish anything. He was 30 years old and he couldn't take anything at school. I mean, he took his degree very late. Anyway, one day I put him down. He says, please help me. I say, we are friends. But again, okay, come on. So I did a lot of sessions with him, but we didn't get anywhere. I thought something really bizarre and wrong was going on with him, but I couldn't grasp it. You see, all these things are evasive. You turn your attention to them and they change, you know. It's not, okay, you cannot grasp it. You try to get into it and it goes away. So I tell him, get all your clothes off, stay naked. All your clothes off, immediately, now. Okay. He takes, okay, lay down. And I started using the electricity and the points that the Chinese 2,000 years ago is writing in, and pressing with him with light electricity, very light. But this light electricity drove him crazy, as if one was putting him thousands of volts. He was resisting, and then, after 20 minutes of electric stimulation, there comes out of his body a terrible, foul odor, a smell, horrible, as if you are burning tires, of this rotten meat and shit in a cesspool, and all this together. Can you mix that with your imagination? The worst thing you have ever smelled in your life. And I said, what is this? This is unbelievable. So I take him, and I put him in the shower, and I start throwing water on him with the shower, because water is something that cleans us. It has a cleansing effect, and the water it is protective. The running water is protective. Now I turn back to the bed, and the bed was still smelling and stinking, and that disgusting thing was there still. And the question is, what kind of psychotherapy can you do to a stinking smog? How can you tell him, go out of here? What is this thing there? I mean, how can you deal with that thing? Okay, I took my candles and I put incense, and I said, okay, the powers of light, come down and clean up the place. Nothing was happening. It was still there. It was still there, and you couldn't approach it. The smell was appalling, to say the least. So how can one person get rid of that? I don't know. I have no idea. It went away, after all. But that's why I said to you, Lynn, a while ago, when you put a person in hypnosis, are there any dangers, you asked me. And I say yes. Now I say yes, there are dangers. You do not know what you will find when you put a person in trance.
How did the entity finally leave?
Thank God time worked and it disappeared. I kept on lighting candles and incense, and trying to get it out, but it was a place that I do not live there, so it just disappeared. I guess the sunlight.
Next time you might try salt.
Excuse me?
Next time you might try salt.
Salt, yes, I use it, salt, all the time. I say that to all my clients. If they have such problems, please use salt. It's a perfect, thank you for the input, it's a perfect crystal. And these entities, these energies cannot accept salt. So it is a good protection. Running water, salt, a flame in the house, it's always good, just to protect yourselves. Yes, please.
Have you had much experience with outside or with external entities, certain people?
Yeah, very interesting case.
What do you do then?
Okay. Well, it seems that we act as magnets, I know Hans, for instance, he's attracting, Hans is our president in the association in Europe. He's attracting all the time extraterrestrials, okay? I have had 3 such cases in my archives. I don't know what to say. I was astonished. I accept them, of course. We are not alone in this universe, and these entities behave totally differently. The first one I had was, this guy was a very abrupt guy, a very crude guy, let's say, but he was a mathematical and physical, in physics, a genius. He could do in mathematical analysis that not a professor at a university could do, like this. Well, I tried to take him out. He was a possessing spirit. This particular extraterrestrial was a possessing spirit, and he wouldn't get out, and I didn't insist. He didn't want him out, because he thought that if that entity went out, he would be dumb, and he wanted to be smart. So, why not? Yes, please.
I had a gal once that she was very psychic, bright. She had a degree in psychology, but went into marketing.
Mm-hmm.
And this entity, which was not human, the way she came to me, she says, "I'm afraid to fly." And I was like, "Well, it's just a phobia." And as we talked more and more, it wasn't her that was afraid to fly. It was this entity picking up the anxiety of those around her.
Mm-hmm.
And we had many sessions, and finally last session I said, "This isn't you. This is something outside you." And she said, "Well, I'm afraid," because she's fairly psychic. She didn't show that to people, but she's very psychic. She says, "I'm afraid if I ask it to go, I'll lose my psychicness." And I said, "No, it came to you because you are psychic and you're going to help it to get home." And that changed it.
That changed the perspective immediately. Everything turned upside down. Yeah, finito. Yeah. Interesting.
I found that not only people can have entities attached, but I removed one from a horse that could barely walk. He could hardly move. And it was dug in at the hip. And Spirit told me how to dislodge that entity. So it's not only people.
No, of course not.
Animals.
Yeah, of course. But animals don't talk. And so it's really difficult to get... Yeah, only with a medium, only with indirect means. You don't accept the evil eye. But in Europe, and especially in Greece, we have what we call, well, from the time of Socrates, it's recorded the evil eye. Okay, he has the evil eye. He looks at you and you fall down. You crash with your car. And there is, of course, a chant. Okay, and through the chant, you supposedly restore the balance of energy. Okay, well, there was a horse that could not move, and he was a beautiful Arabian, nice, and he was like this. So I saw it with my eyes, and somebody said, "Oh, this horse is hidden by the evil eye." Okay, and they brought in a lady who was reading this chants. She was good at it. Immediately after she sang these chants, the horse went back again and was ready to strike again and run. I mean, seeing is believing.
So what chant was that?
The chants?
You said chant, right? Chant. The evil eye chant.
It's a prayer. Is it a prayer?
Chant, a prayer, yeah, a charm, yeah.
Well, what is it? Is it a set routine, words?
Yes, it's words. In antiquity, the words were, we found through Plutarch. Plutarch is a Greek in the Roman era, and he has the biggest written records in antiquity. I mean, he has written more than 10,000 pages of, he's really a great writer, Plutarch. So he writes about those things. And he tells what the people did. And he was in the Delphi, he was a priest in Delphi. He was an archpriest in Eleusis and the Eleusinian mysteries. He was the top of the top at the time. And actually, through him, we have learned a lot of things through antiquity. And one of the things that we learned is the chants from that era. I know the words. I use them all the time. Yeah.
Is it in your book?
Excuse me?
Are the words in your book?
No. No, I don't give out all my secrets, okay?
So you're telling us that you've released all these different possessions, if you will, but you haven't addressed the what you do with them, or are you basically casting them back out into this planet and they pick some other unsuspecting who now has to come to you, so to be cleaned up.
Okay, you mentioned, yeah, I got the point. This is the most important point mentioned, which was not addressed, because this is not a seminar, a workshop of 2 days. So at least we would need 2-3 days, let's say 2 weekends at least, to really go into depth with this subject. So very rightly, what our friend is saying is, okay, what do? You have them out, you cast them out, and then what? No, that's not the process. That's, okay, I cast out that little stinky thing. That's out there. I don't know what it's doing now. Probably found another guy and went in, okay? Yeah, that's probably true. Yeah. But when you have an entity which is human in nature, and most of them, 95% of them are human, the thing is to do psychotherapy with them. I mean, okay, you are in trouble, you are here. Work with this entity, this possessing, attaching entity, as if it was a human being which deserves to be in therapy. And release that entity and let it go to the light, or wherever it wishes to go, but with a good meaning, If I wish to jump from you and go to the other guy, that's not what we want. We don't allow that to happen. We avoid that, and we may spend hours in the session in order to avoid that to happen. But it may happen. They can fool you. They can trick you. They can do a lot of nasty things. So I cannot guarantee you that I'm always doing that, but my intention is to really make them understand in what condition they are. The reason I use electricity is to really to show them that I am the strong guy. I'm the strong guy, and you come and negotiate with me, okay? I mean, Bush did not go to Saddam Hussein and said, let's sit at the table. He sent all his aircraft carriers there and all his Air Force. He said, okay, do you want to talk or not? Do you want to surrender or not? That's how modern negotiation is taking place, and sometimes you have to be that way also. You have to be mean. And I don't know whether that was good, what was done. I'm not saying that Bush was a good guy. What I'm saying is that if you show power, the other guy will back up and say, okay, let's talk about it. But that is the last resort. I never do that beforehand to speed up the process. No, I will let it go on its own. Because usually, mostly, these entities want to find their way. And if they find their way, we have two goods. The first good is that the entity, which was suffering all these years, is released finally, and it is going to the light. The other good is that your client finally has been relieved. And the third good is that your client immediately becomes spiritual. Immediately he will start, she will start looking at books and study things, and suddenly it is like the near-death experience, okay? It's life-changing. It's transforming. This experience is also transforming. I mean, imagine now that you are a person and you have a hunchback here, and in that hunchback there are hundreds of, you carry them, you do not carry only yourself, you carry others as well. Would you want that? I wouldn't want that. Who would want that? That's my point. Yes, please.
I can certainly appreciate and see the necessity and great service for this type of work. But today, I don't know how many years now, we hear a lot about past life regression, and that there are, I'm sure, other dedicated people.
Excuse me, can you speak a bit louder?
There are many, well, I don't know, many, a number of dedicated people like you that are doing this kind of past life regression, hypnotist service for people. If you have no indications, let's say, of obsessive or any possessive type problems, is it still beneficial, as I'm led to believe from some of the readings today, that past life regression is helpful for any of us? Is that a service for us in any kind of, let's say, spiritual or good way for you on your soul path?
That's a very good question. I will answer indirectly. Okay, some people come in to me or to colleagues and they say, oh, please, get me into my past life, I want to see what I was. Okay, you say, I play the game. I play the game. Okay, listen, please lay down. What do you see? Nothing. Okay, what do you see? Nothing. Now, what do you feel? Nothing. Okay. It doesn't work that way. What I mean is, if a past life is to come to your consciousness, it is because it is allowed to you to recall such a past life experience. You have the ability You get my point, what I say? You have the ability to tune in into your archives and get that information, retrieve that information from there. That is, since you are given that gift, that's a charisma. It's like the musical ear, okay? Either you are born with it or you're not born with it. No matter how much you try to become a musician, if you don't have that, you don't have anything. It's the same thing with past life recall. Not all of us can remember or recall our past lives. Some of us can, some of us cannot. There is a reason for this. I do not know the reason for one person, and the reasons for several persons are many to be addressed in this case, in our presentation. I'm saying that if it is useful, it will come up, and if it will come up, it will transform your life, and it will change it for good. Of course, I would be a liar if I would say that there have not been adverse effects. If you do not conclude a session properly, you may have a hangover, let's say. That person almost getting schizophrenic. I've done that twice to clients of mine. I've done that mistake. I know how it is. And it's really bad. But I learn from my mistakes. I cannot learn from being perfect. You make mistakes along the way. And the good thing is if you can assess them and see that they're mistakes and you understand why you did that and how you can avoid it in the future.
The time management thing. Okay, you basically have talked about the fact that it takes multiple sessions many times to locate this possession.
Not necessarily. It can be in one session.
I understand, but so we have one or we have multiple. And then you said that sometimes it takes 2 or 3 or more hours to actually get this possession cleared. Is this a single therapeutic session on your part that just extends for half a day? Or can you do this in 1 hour, 55-minute increments, where you say, well, it's 5 minutes of the session's over, and I'll park you here and come back next week and we'll work on you again?
No. It's a one-way thing. You go there till the end. That 55 or 50-minute thing is the most ridiculous deal I have heard. It's outrageous. I don't know. Of course, when people do talk therapy, you cannot listen to a person after some time. I mean, your mind flows away. It fantasizes. So it's a good way to make a break. That's one thing. But you make a break there, okay? The point is that personally, as I am working at home, I have one appointment in the morning, one in the afternoon. That's it. This is not to be rich. You cannot make money out of this, okay? You do it, and you do it right. If you want to be rich, do something else. Okay, go to the casino or whatever. This is not a money-making thing. If you want to make money, go to the building business, construction, I don't know, do something else. This is, especially if you accept the spirit hypothesis, this is spiritual work. So you have to keep it there. I have never done group session, never. Brian Weiss, the well-known, very good. He did very good that he wrote his books, and all people have read them. Millions of copies have been sold all around the world. He did a great, and we are indebted in regression therapy because of him. But you cannot have 1,000 people in a hotel and then do a mass past life regression session. Each one of us reacts differently. Who is going to moderate? You, her, him? Who's going to do that? I mean, this is absolutely unacceptable to my opinion. Okay. Yes, please.
So again, how do we get rid of the external entities? I mean, I have a client and the external entities are nipping at his feet and poking him and all kinds of stuff like that.
You buy my book, you buy my book, you read it, you read it, and then you ask me to come back in America, you create a group here, okay, and then we have a really deep training where I can show you how it's done. I cannot say, it's not, you know, you don't just press a button and this thing goes out. It's a process. It's not, this, I press the button is, you know, it's industrial. We are not industrial here. We don't press buttons. We have to first of all make a differential diagnosis. What is this entity that is possessing our client? What is it? That's the first question. What is its nature? Why is it here for? I'm not saying, by the way, the most important thing, you say the situation brings out. Do you think that the client is not responsible for his his malady? Of course. He attracted it in some way. I mean, why didn't it walk in you and it walked in him? Why? Because he did something. Either in this life or in the former life. So you attract them. I had attracted it because I had done my nasty things in former lives. So I had that entity following me up. Okay? So I had my share of responsibility for what was happening to me. Now, so our clients are not victims. They're not victims all the time. No. They are responsible for what's happening to them. I mean, okay, I can understand once we had a session in Germany. It was in a group and a girl came up. She answered that questionnaire, a lady of 54. And she had a very, very high degree, above 120 scale. So as I saw the paper, she had been raped. Now, rape is the worst thing that can happen to a human being, whether it is a man or a woman, especially if it is a woman or a boy. And if you see rape, oh my God, there must be something really bad in there. Because the aura breaks totally. So here is that girl, that lady, I hypnotize her, and she's at her 4 years old. And her parents go to church. It's Sunday morning, I think. And a guy, a farmer from next door, walks in, goes up the stairs, finds the little girl in the bed, undresses, and rapes her. 4-year-old girl. Okay. This lady relived the whole experience in front of an audience of about our size here. So you say, oh, the poor victim, the poor thing. What would you say, of course? Well, she detached herself from her body as he was raping her. Her soul was detached. And she left and went towards a blue light, where she felt some peace there. And she